cracked teeth with reversible pulpitis after orthodontic banding. It is a prospective cohort study that is done by Dr. Rachel Seet and her group in 2022, and it is published in Journal of Endodontics. Their study, it aimed to determine a short-term outcomes of cracked teeth with reversible pulpitis following orthodontic band placement. Also, they aim to determine the duration of orthodontic band use before definitive bulb diagnosis. In this study, they had 125 cases to assess 10 prognostic factors. These cases met the inclusion criteria, which are patients with one cracked permanent premolar or molar that is diagnosed with reversible pulpitis, and whereas the crack can be visualized directly. Also, they included teeth that are functional in occlusion with the opposing dentition in patients who aged 21 or older and who are classified as an ASA 1 or 2. They excluded patients who are diagnosed with generalized chronic periodontitis, teeth that requires post-retained core for restorations, teeth with more than 5 mm periodontal pocket, and teeth with periapical lesions. This is a flow chart of the recruitment and the treatment process. Patients were asked to fill a survey that included a visual analog scale to assess the preoperative pain at rest and when it aggravated. After that, the clinical and radiographic examination performed and the crack assessment after the removal of previous defective restoration, where the crack line sealed by resin-modified glass ionomer liner and teeth were restored by composite resin restoration. Then orthodontic band fitting and cementation, and patients were followed up for 6 months. If the symptoms resolved, the patient will be referred for coronal coverage restoration, and if the same symptoms persisted or it increased during this 6 months period, patient will be indicated for root canal treatment. Out of the 125 cases, 3 cases were lost to follow-up, and they found that 92% of the cases were diagnosed as normal bulb after the band placement, and 9 cases were indicated for root canal treatment. Also, they found that the median time taken for the definitive bulb diagnosis was 39 days, and the median time taken for the progression to irreversible pulpitis or bulb necrosis was 3 months. Regarding the prognostic factors that they assessed, they evaluated the presence or absence of parafunctional habit, presence of occlusal wear, number of triggering factors, pain on biting or release, tenderness to percussion, cusp angulation, number of cracked surfaces, the score of the preoperative triggered pain, terminal abutment, and the presence of distal crack. And they found that none of them were associated with the resolution of the bulbal symptoms. However, a higher score of the preoperative triggered pain and the absence of the distal marginal crack were correlated with a longer duration before a definitive bulb diagnosis.